Do you look tired, even when you are not? I'm Dr. Chandrashekhar Chalwade. In this video, I'll explain why dark circles happen, the different types, and what treatment options actually work. Almost every week in my clinic, someone says this to me. Doctor, I sleep well. I feel fine. But I still look tired. And I understand that frustration. Because when you look in the mirror and your face doesn't match how you feel inside, that can really affect your confidence. There is so much advice online. Creams, serums, home remedies, miracle treatments, that it becomes overwhelming. So today, I want to simplify this for you. Let's understand what dark circles really are and what actually works. First, something very important. Dark circles are not just about lack of sleep. Medically, we call this condition periorbital hyperpigmentation. That simply means darkened discoloration in the under-eye area. It is a recognized clinical condition, not just a cosmetic complaint. And you are not alone. Studies suggest that up to 30% of people experience this, often beginning in late teenage years or early adulthood. So this is not only about aging. Genetics, skin thickness, bone structure, all play a role. Now here is the most important part of this entire discussion. You cannot treat dark circles effectively unless you know the cause. That one eye cream that promises everything, it may not work. Because your dark circles may not be caused by what that cream is targeting. In clinical practice, we classify dark circles into 4 main types. Let me explain them clearly. First, the pigmentary type. If your dark circles look brownish or darker in color, this usually means excess melanin. Melanin is the pigment that gives skin its color. This type is more common in individuals with darker skin tones. It can be genetic. Sun exposure can worsen it. Even rubbing the eyes can make it worse. Here, the problem is pigmentation. Second, the vascular type. The skin under the eyes is the thinnest skin in the entire body. In some individuals, it is almost translucent. The small blood vessels underneath become visible. And that creates a blue, pink, or purplish tint. This is not excess pigment. It is visibility through thin skin. Third, the structural type. This is extremely important. Sometimes the issue is not color at all. It is shadow. There is a natural groove between the lower eyelid and the cheek. We call it the tear trough. If there is volume loss in this area, or if you are genetically predisposed, light falls differently, and it creates a shadow. That shadow appears as a dark circle. No cream can fix a shadow. This requires structural correction. And finally, the mixed type. This is the most common. In fact, most patients have a combination. A little pigment, a little thin skin, some tear trough hollowing. It is rarely just one single cause. And that is exactly why professional diagnosis matters. Without identifying the type, treatment becomes guesswork. Now let's talk about treatment. Once we identify the cause, we can design a plan. If the issue is pigmentation, we may consider prescription topical agents, chemical peels, or selected laser treatments. If it is vascular, specific lasers, or treatments that improve skin thickness may help. If the problem is structural hollowing, we consider hyaluronic acid fillers to restore volume. These give immediate improvement, but typically last 6 to 12 months. For patients looking for longer-lasting and regenerative options, fat grafting becomes very interesting. We use microfat to restore volume and nanofat to improve skin quality. Nanofat contains regenerative components that help thicken and improve the skin over time. This addresses both volume and skin quality together. Broadly speaking, treatments fall into two categories. Non-invasive, like creams, peels, and some lasers. And minimally invasive, like fillers, PRP, or fat grafting. The correct choice depends entirely on diagnosis. Now let's talk about expectations. This is extremely important. There is no single gold standard that completely erases dark circles in every patient. The goal is significant improvement, not perfection. In clinical studies, most patients achieve noticeable reduction and report high satisfaction. Even a 50% improvement can dramatically change how refreshed you look. Chasing perfection leads to disappointment. Aiming for meaningful improvement leads to confidence. After treatment, recovery matters. If you undergo something like fat grafting, there will be swelling and bruising in the first few days. Most patients resume light activities within 1 to 2 weeks. Final results may take 3 to 6 months to fully settle. Patience is key. For any treatment, aftercare principles remain similar. Sleep with your head slightly elevated. Avoid heavy exercise initially. Use cold compresses as advised. And sun protection is absolutely non-negotiable. Sunscreen and sunglasses protect your results. Long-term maintenance is also important. Consistent skincare, sun protection, healthy sleep, hydration. These all contribute to sustained improvement. So what is the one message I want you to remember? Everything begins with an accurate diagnosis. Not guessing. Not experimenting endlessly with products. But understanding the why behind your dark circles. Once we understand the cause, we can design a treatment plan that is safe, effective, and tailored specifically to you. If you are struggling with dark circles, don't assume it is just fatigue. It may be pigmentation. It may be vascular visibility. It may be tear trough hollowing. Or a combination. And each requires a different strategy. Thank you for watching. Feel free to contact us